My name is Rachel King, and I'm a nursing student at the University of South Alabama. And today I'm going to be demonstrating how to insert a catheter. So first I'm going to verify the order, and I'm going to read off the indications for the indwelling catheter. So required immobilization for surgery, trauma, or other therapies, acute ventilator-dependent respiratory failure, or an acute worsening of mental status. So now I'm going to check the patient's two identifiers on their wristband. I'm looking at the name, Jaguar Jones, and the medical record number 4176352, and I'm also checking for allergies. I would also ask the patient about their allergies. So now I'm going to put in my goggles, position my trash can, perform hand hygiene, and I would raise the bed to a comfortable working height, lower the side rail, explain the procedure to the patient, and ensure their privacy. So I would lift the sheets from the bottom up like this and make sure that they're in dorsal recumbent position. And at this point, I would don clean gloves and perform perineal care. So for a female, you would wash and dry the upper thighs, and then you would wash the labia majora using the dominant hand to wash the skin folds. You would wipe from front to back and repeat on the other side with a clean washcloth. You would separate the labia with your non-dominant hand, exposing the urethral meatus and vaginal orifice. Also doing a front to back technique with your dominant hand. You would also clean thoroughly over the labia minora, the vaginal orifice, and the clitoris, and rinse and dry. And for a male, you would wash and dry the thighs, grasp the shaft of the penis, and retract foreskin if necessary. You would wash the urethral meatus first using a circular motion, like an outward circular motion, and you would do that at least 3 times. Gently rinse and dry, and return the foreskin if necessary. You'd take a washcloth and clean the shaft of the penis and the scrotum, and you'd lift the scrotum and wash the underlying skin folds and rinse and dry. So I'm going to get my kit. So I'm going to open it away from me, making sure I don't get past the 1-inch border. Okay, now I'm going to don my sterile gloves. I'm going to come over here real fast and do that. Okay. So now I'm going to take out my sterile field. I'm going to place the shiny part down. Take my tray. So I'm going to prepare my lubricant. Let's squirt it right there. And then I would take the betadine and pour it over the cotton balls, but we only have this in our kit, so I'm just going to set it right here. So I would first start by getting a cotton ball and cleaning the side farthest away from me, and then the side closest to me, and finally the middle. I would use a different cotton swab each time for that, and I would go in a front to back motion. If this was a male, I would start by cleaning the urethral meatus and working my way to the glans pubis, and I would do that 3 times. I would also make sure that the penis was kind of like perpendicular, so there's a little bit of traction for cleaning. So I've put my lubricant in there. So now I'm going to remove the plastic from my catheter. Okay, and I'm going to dip it in the lubricant. So if this was a female, it would be 1 to 2 inches, and if it was a male, it would be 5 to 7. For a male, I would also insert the catheter all the way to the bifurcation point. So the catheter would go all the way in. So now I'm going to attach my water to the balloon pump, just like that. Okay, so now I'm taking my non-dominant hand, and I'm going to expose the urethra, and I'm going to insert the catheter until I see urine return. I would also let the patient know that I was about to insert and tell them to prepare as if they were going to void, or have them take in a deep breath and exhale. So at this point, this hand over here is no longer sterile. So now I would push in all of the fluid to inflate the balloon, and I would hold pressure on the plunger after all of the water has gone in there. So here we go. And for the integrity of my stuff, I'm just going to lay this right here on the table because I don't want to throw it in the trash. So now I'm going to get my stat lock, and that was the end of the sterile part of this procedure. So with the stat lock, I would clean the inside of the thigh with this alcohol wipe to prepare the skin. And then before I attached it, well, I would stick this on the inside of the thigh. Before I attach the tube to the lock, I would make sure that there's slack in it to prevent injury to the urethra. So this would be stuck right here on the inside of the thigh. And this catheter is going to come out multiple times, more than likely. I've not been able to do this without it coming out, so I'm going to put it back in, which is obviously a break in sterility. And like I said, that would be on the inner thigh. It's not. Anyways, so let me think. Oh, I would now for the drainage bag, I would secure it to the bed frame, not the bed rail, and make sure that it is below the bladder level. Oh goodness, it is all twisted. Really? Okay. So it would be below bladder level on the bed frame. So at this point, I'm gonna throw all of my stuff away. But I'm actually just gonna set it on the floor because I don't want to ball it all up. And remove my gloves. So now I'm going to put on my clean gloves to collect a urine sample. Oh my. I guess I could have just left on my sterile gloves, but oh well. So to get a urine sample out of this bag, it would normally be hanging on the bed rail, and I would have my graduated cylinder laying right under it. So I would remove, and the catheter is probably going to fall out again. I would remove the spout, and I would obviously also have the lid off of this, and hold it over the graduated cylinder, making sure that these two do not come into contact. You'd have to push this button right here to release the urine, and click it back to stop the urine. So after that, you would just put it back in the little socket, and that's it. So the label for the sample should never be on the lid. It should only be on the side. Now, if I was going to collect a sample from a catheter that's been in for a while, I would lay out this waterproof pad. I knew it was going to happen. Again, it should not, that would not normally be a thing. Okay. And it would also still be in the stat lock, not falling out of it. Okay. So, if I was collecting a sample from a catheter that had been in for a few days, I would unclip this from the bed, create a bend in this line. Let me see. I'm gonna do it right here. To clamp that so that the urine can collect up here. And I would take my 10 milliliter syringe and put it into the port and retract my sample. I would clean the port before I stuck in my syringe, but so I would take the sample, put it in here, again making sure that there's not any contact being made there. Discard of this, but I'm just going to set it on the table. Making sure that that label is on the side, excuse me. So at this point, I would lower the bed, raise the side rail, perform hand hygiene, and I would document the size of the catheter I put in, the size of the catheter, the amount of urine, the color of urine, the consistency, and if a specimen was collected. And since I put in the catheter, you would want to, or I would want to make sure that perineal care was happening daily with soap and water. And yes, so to remove the catheter, I would also need to put these gloves back on because I used them earlier and I shouldn't have. So to remove the catheter, we're obviously going to raise the bed back up, lower the side rail, re-expose the patient, have them in dorsal recumbent, and you're going to take your 10 milliliter syringe, attach it to the balloon port, and water should be coming out of it at this point. And I forgot to do this earlier, but you need to unclamp this catheter, unclamp the catheter after you take the urine sample, or else the urine, it won't be able to flow into the bag, and that's really not good. So make sure that you unclamp it. But anyways, so whenever you're taking it out, the water will begin to fill into this syringe simply from gravity. And so once it's filled, you can remove it. And again, I would normally throw that away. So you would just simply spread out the labial folds and inform the patient of what you're doing, and retract the catheter. And this luer lock would be cooperating, but of course it's not. And then I would throw all of this away, but I'm not going to. So you would need to note the amount of, or I would now need to document the amount of fluid, if there was an odor, the color, the consistency, if the catheter tip was intact, what time I removed it. I think I already said how much water. And I would also teach the patient of UTI symptoms. So now I would cover the patient back up, remove my clean gloves, lower the bed, raise the side rail, and perform hand hygiene.